Hi, everybody. Welcome back to Mastering Medicare. I'm Dr. Lance Koss, and today we'll be talking about one of the biggest mistakes people make with Medicare, choosing the wrong coverage and getting stuck in a plan that just doesn't work for you. If you've ever felt confused between Medicare Advantage and Medigap policies, or wondered why you're paying so much, or you can't see the doctors you want anymore, you're not alone. Let's break this down so you don't end up trapped in a plan that just doesn't fit your life. So when you first enroll in Medicare, you basically have two main paths: original Medicare, usually with a Medigap plan, or option 2, Medicare Advantage, also known as Medicare Part C. So what's the difference? Well, Medicare Advantage, or Part C, plans bundle your hospital, medical, and usually some prescription drug coverage into one plan through a private insurance company. But you're in a network, so if your doctor's not in the network, you might have to switch or end up paying out of pocket. Same with your hospital. And while premiums are often lower, the co-pays and out-of-pocket maximums can often surprise you. Medigap plans work with original Medicare. There's no networks. You can go to any doctor or hospital in the country that takes Medicare, but on the flip side, you'll pay higher monthly premiums, but your out-of-pocket costs are typically lower and more predictable. So what goes wrong? People often chase low premiums without understanding the trade-offs. They pick a Medicare Advantage plan with a $0 monthly premium. Hey, that sounds great. Until they realize that their favorite doctor isn't covered, the rehab facility they need to go to is out of network, or they have to get referrals just to see a specialist. Even worse, by the time they switch to Medigap, their guaranteed enrollment window is closed, and now they could be denied Medigap coverage or charged more due to pre-existing conditions. So there's 3 big mistakes to avoid. Number 1, choosing a plan based only on premiums without adding up what you'll actually pay over the course of the year. Number 2, not checking the provider network. And number 3, missing your one-time Medigap enrollment window and losing your guaranteed access. So how do you choose wisely? Start with checking your doctors. Are they in the network you're looking for at Medicare Advantage? Estimate your total costs, not just the monthly premiums, but add up your co-pays, your deductibles, and the out-of-pocket maximums. And above all, think long-term. What if you get sick? What if you move? And my big professional tip of the day, use the tool Medicare gives you. So let me show you how this all works. You can go to Medicare.gov/plan-compare. If you have trouble with that, just Google compare Medicare plans and you should be able to find it. Either way, you're going to make sure when you land on this page that it has the Medicare.gov logo up here at the top and looks like this main plan finder page. Once you're on this page, you can continue one of 2 ways. If you're just browsing, you can continue without logging in. But if you already have a Medicare account, I strongly recommend logging in so you can save your prescriptions and doctors for future comparisons. For the purpose of this demo, I'm going to continue without logging in, but I do need to add my zip code. Once I add the zip code, it wants to know what county I live in inside my zip code, and then I'll continue. Once you're here, I can do one of 3 things. I can look for Medicare Advantage plans, I can compare Medicare drug plans, or I can look for Medigap policies. I'll show you the first one. Let's say I want to compare Medicare Advantage plans or Part C plans. So we're going to click on the plans. It's going to ask me some additional questions. Do you get help with your Medicare health or drug costs? Do I have Medicaid, supplemental security income, Medicare savings programs, extra help with the drug costs? I'm going to say I don't get help from any of these programs and continue. This is really cool. Now it's going to ask for my search preferences. Do I want to add my drug costs into the comparisons when I compare plans? Well, of course I do. That's a huge part of the expense. So I love that they add this. So I'm going to say yes and continue. So it's going to bring up, okay, well then I need to know what your prescription drugs are. Let's say I'm going to say I'm on Synthroid, which is a common medication for thyroids. As you can see, as I begin typing in Synthroid, it pulls up a list and I can eventually just select it from that. When I add the drug, it's going to want to know Would you consider adding generic versions of this, which are usually cheaper, same medication? I'm going to say sure. The next thing it wants to know is my dose. You'll see it gives you all the common doses that are prescribed for Synthroid. I'm going to say I'm on the 50. They take it once a day, so 30 a month. I'm going to add this to my drug list. It's going to say, do you want to do this? And I can keep adding an unlimited amount of drugs here, but I'm going to say I'm done for the purpose of this demo. So now it's going to say, what's your location? And it's going to ask what pharmacy I like. The closest pharmacy to me is Walmart, so I'm going to say, let's add that. And it's going to say, great, let's continue to view plans down here. Now it's going to bring up a list of the plans that are available in my zip code for me based on the information I have. And you'll see each one tells you what they are and has a star rating, monthly premium, drug and premium costs, and other costs. And it gives you a little summary of what's available on each plan. You can filter up here by, is it important for vision or who it is, your drug coverage. I like star ratings. So let's say I only want to look at good ones. So I want 4 stars and above. And it'll reset my list. I can also sort plans by the lowest drug and premium cost, lowest your deductible, lowest monthly premium, etc. So you'll see, as I said, it gives you a brief summary of each plan, and there's a whole bunch of them. So how do you know which one's the best for you? Well, I can compare up to 3 plans at a time just by selecting this box here, add to compare. So you'll see it puts 1 plan to compare. This one looks interesting. I'll add that one too. And let's see what this one looks like. So now that I have 3 plans to compare, let's compare them. It's going to bring up a table of putting the 3 of them across each other, and you can see they all have a 4-star rating. They all have 0 health deductible. 2 of them have 0 drug plan deductibles, but this one in the middle has $340 deductible. Want to keep that in mind. That same plan also has a higher maximum than I would pay for health services, while this first one has the lowest maximum I would pay for health services. You can go on and continue these as you go on. And look, they all 3 give you vision, dental, hearing benefits. This one over here provides transportation to and from your appointments, where the other 2 don't. So if that's important to you, this one suddenly is starting to look more important. And you'll see you can just go through all of the different options. It lays them all out here for you, everything from what you would pay to see your PCP, specialists, labs, diagnostics, emergencies, x-rays, until you see which one looks the best for you. If you decide, okay, I'm going to go with this one, or I want to go back to the other page and compare more, you can do that. I'm going to say I'm going to do this one. So now it says I'm going to enroll in the Blue Cross Medicare Advantage Basic HMO plan, and let's join the plan. And then it's going to ask me for a whole bunch of information to continue my enrollment. Obviously, I'm not going to join this plan today for the purpose of the demo. But the other thing you can do is go back to the first page here. I'm going to back up. Remember this page? We logged in. Let's say instead of looking at Medicare Advantage plans, I'm going to stay on the original Medicare, but I want to look at what Medigap policies could supplement my original Medicare. So I'll click here. I'm going to find a plans. So when you land on this page, you could provide additional information. I'm not going to. And you'll see that Medigap plans follow a letter designation. There's Plan A, Plan B, Plan C, Plan D, Plan F, F high deductible, G, etc. for my area. You can get a deeper dive on each one of these, or the other thing that's really nice is on this, I can compare to other plans, and it brings up the table and puts them all next to each other. So you'll see they all provide Part A, but only these provide Part B copays and coinsurance, where these have a 50 or 75%. So K and L have more money out of pocket from you. And you can kind of figure out which one looks best to you. I'm thinking, maybe, obviously the more you get, the more you pay. So you got to play around with that. And then if I close this and say, I want to take a deeper dive on this plan F, what's it look like? I can go into the actual plan details, get a deeper dive on what it actually means, and I can view their policies. What does it mean? These are the ones that are available to me, and I can go in and pick my policy underneath here. This is going to take some time. You won't want to rush this. Go through. You can keep going back and forth, looking at them, comparing them. I would highly recommend you use this Medicare.gov tools that are available to you. So as you can see, that tool is incredibly helpful. And best of all, it's completely free. Why wouldn't you take advantage of it? So now what happens if you're already in a plan that doesn't work? Well, you might still have some options. The annual enrollment period goes from October 15th to December 7th every year, and it lets you switch Medicare Advantage plans or drug plans. The Medicare open enrollment period runs from January 1st to March 31st if you're already in a Medicare Advantage plan and want to change. And there are also special enrollment periods for things like when you move or you lose coverage. So what I like to do every year, right after Thanksgiving, my mother, who's on Medicare, is on a Medicare Advantage plan, gives me all of her information, and I go through the comparison for her zip code, and I check to make sure that the plan she's on is still the one we want to keep for next year. So let's talk about the other option you had. What if you're not on a Medicare Advantage plan, but you chose original Medicare with a Medigap policy? What happens if you want to switch that Medigap policy after your initial enrollment window? Well, that's a tricky part. You might be subject to medical underwriting, and there's no guarantee that you'll be accepted. So make that first decision count. Using the wrong plan isn't just inconvenient. It can cost you thousands of dollars, limit your treatment options, and leaving you feeling stuck. So take your time, use the Plan Compare tool, ask the right questions, and make sure your Medicare plan works for you, not the other way around. So thanks again for watching Mastering Medicare. As always, be sure to like below, subscribe so you can know when the next episodes are coming out, and most of all, please share this episode with anyone you know that could really benefit from the information. So until next time, stay informed, stay covered, and stay empowered. I'm Dr. Koss, wishing you good night.